Hello, my name is Naomi Sachs. Welcome to the Center for Health Design's Evidence-Based Design Journal Club. Thanks for joining us today. Today's topic is Restorative Design Features for Hospital Staff Break Areas, a multi-method study. I'm Naomi Sachs, your host for today's. As a bit of an introduction, I'm founding director of the Therapeutic Landscapes Network, a resource that promotes health and well-being. And I'm also co-author with Claire Cooper Marcus of the book Therapeutic Landscapes. I have a Master of Landscape Architecture from UC Berkeley, and I'm currently a PhD candidate in architecture at Texas A&M University. The purpose of the EB Journal Club is to engage the healthcare design community in dialogue regarding important research to help us better understand the built environment and health-related outcomes, and to apply it to the world. Continuing education units are available for this webinar from the AIA and from EDAC. To receive credit for your participation, you can download the forms at any time by clicking on the Show My Media library located on the top toolbar where the red You'll have access to the AIA quiz, the EDAC form, and today's presentation slides. To download a file, click on the green arrow next to the file. When you're finished, click the double right arrow in the top left corner of the media library. The library will close and the slides will. For EDAC credit, complete the verification form and retain it for your records. You need to submit the form to Castle Worldwide at the time for your renewal. For AIA credit, complete the verification quiz, purchase a CEU management fee for $10 from the CHD store, and submit the verification form to Shannon Reckline. She'll upload the credits to your AIA account. You'll find Shannon's email address included on the form. I'd like to take a moment to review how to use the chat feature so that you can ask questions or submit comments on what you hear today. As shown on this slide, just type into the chat box where the red arrow is pointing. Sure, your questions are to all so that all attendees of the call are able to see your message. If you're having any technical difficulties, please type your issue to moderator in a private conversation, and we'll see how we can help. And now I'd like to introduce you to today's author, Dr. Adela Najad. PhD graduate from the Center for Health Systems Design at Texas A&M University. I was fortunate to have overlapped with Adela during her doctoral dissertation on restorative design features for hospital staff break areas, which was recently awarded as the best PhD research project by the International Academy. She also received the Joel Polsky Academic Achievement Award from the American Society of Interior Designers for her outstanding doctoral dissertation on design and well-being. After 3 consecutive summer internships, Adela has recently joined HKS Architects, lucky them, and Cadre as a full-time designer focused on integrating research into practice. Thank you, Adela, for joining us today.
Hello, everyone. Thank you, Naomi, for hosting us.
My pleasure. As I mentioned, we're hosting this event to identify the everyday practical applications of research findings in a published article. Today's featured article is Restorative Design Features for Hospital Staff Break Areas, a multi-method study from the January 2016 Health Environments Research and Design Journal. On today's call, we will have an active discussion about key factors in Adela's study. So Adela, I will let you go.
Hello, everyone. Thank you so much for joining us today. I wanted to thank the Center for Health Design for this opportunity, and I wanted to thank my dear friend Naomi for hosting us. So just a summary of this session. This paper came out, my doctoral study at Texas A&M, and the main aim of this study was to investigate Staff break areas and staff respite areas, their break patterns, their preferences, and perceived restorative qualities of these areas within healthcare facilities. And we conducted this research by implementing 3 methodology: focus interviews, written surveys, and visual assessment. And the study led to a set of policy implication and design recommendation that we are going through it in this presentation.
So Adela, what led you to be interested in?
So Naomi, you know that, when you start PhD, going through some coursework and starting, reading literatures and attending the conferences, I noticed that a lot of studies nowadays are focused on patient rather than staff. We don't have a lot of studies have been done on nursing staff within healthcare facilities, and also the studies that have been done on nursing staff are more focused on the work areas, the patient care working area. And I really noticed the lack of, knowledge and evidence on staff respite areas and break areas. So I started doing a more, in-depth literature review on the topic of just nursing profession. We all know it's a very challenging profession. I looked at the stress, I looked at the fatigue and exhaustion, and the consequence of stress and fatigue on staff, patient, and facility outcomes. I was curious about the barriers that prevent nurses from taking break. I looked at the policy, the programs, and then and lastly but not the least, I looked at the healthcare facility and how we are designing those break areas. So the project really came, from the literature search and literature review that I did at the beginning. And the significance of the project, the first and I think the foremost important one is just raising that awareness of importance of restorative break. For nursing staff in healthcare facilities, I really wanted to contribute to the healthcare industry in terms of empirical evidence that can help us in any, terms of policy and design intervention, and I wanted to contribute to the knowledge that can protect this important space when we are doing programming and strategic planning. And finally, I wanted to know what are those main principles of restorative environment for these spaces. So one of the main objectives of this study was understanding the main challenges that prevent nurses from taking those restorative breaks in healthcare facilities. And the second objective was assessing their break patterns, seeing what are those verbal and visual preferences are, and also their perceived restorative qualities of those specific design feature in staff break areas. And the conceptual model for this study, we usually look at the independent variable and a dependent variable in any research conceptual model. So in our type of research, usually independent variables is the built environment, is that indoor and outdoor staff break areas. And then we wanted to know how they contribute to our outcome variables. It can be a staff usage, their satisfaction, their preferences, and then their perceived restorative qualities. So mediator variables are variables that really connect independent and dependent. We wanted to know what are those constructs of those built environment that can contribute, can be associated to that outcome. So I looked at a few of them here, like proximity, privacy, access to outdoors, access to nature, and the amenities. And we usually control for those moderator variables like demographic information, the work setting, the facility break regulation. So when we control for it, those are not any more confounding variable when we do the analysis. And then in method, so we used first we started with more qualitative methodology, focus interviews. I did interviews with 10 nurses who have worked as a, healthcare consultant in healthcare design and construction industry. They had great years of experience both in nursing profession and healthcare design. And we did written surveys. The survey we designed, it includes some of the questions from some validated survey instruments. We also added a few or adjusted a few, to tweak it for this study. It includes 50 questions, and it asks about the work environment, their break patterns, the quality of their existing, and their preferences for future staff break areas. And we asked Academy of Medical Surgical Nurses in the United States with more than 10,000 members to distribute this survey to their members on our behalf. And also we did the visual assessment. We had 2 sets of visual assessment that was included in the survey. And so we had 2 photos from existing break areas, and then we used Photoshop to create 5 versions of each of those that are exactly the same except for a digital altering related to one specific design feature. Like we added an indoor plant, we added a nature art, we added window and balcony. And I recently published a paper just on this methodology if you guys are interested.
Great. And to let our participants know, those references to the other papers published are at the end of this. And I had a couple questions about this slide. So were the photo surveys, were people actually in this environment, or were they looking at these photos and then saying what they liked best?
So how it was set up, so this was part of the online survey. The participant could see all of the photos simultaneously in their screen. They could actually click on it, make them bigger, see the more details, and then we asked them to evaluate each photo in terms of how effectively it can help them release the stress and feel more refreshed on a scale of 0 to 10. And then the order of the photos changed, randomly for different participants. So they didn't see the photos in this order.
One more question about this. It looks like that view from the window has a building in it. So is that sort of like what they would actually be seeing rather than, a view of the Grand Canyon or something that you might see in a nature photo?
Exactly. So that photo, window is actually a patient window in a patient room from the same facility. And so if we had a window in this room at that facility, that would be the actual, view that they are going to look at. So it had some greenery, had some buildings and sky, and also when we selected that artwork, we selected it, so we have a slightly more attractive, view for that, nature view for that artwork versus that window view.
Great, thank you.
And then we did the analysis. We did the data analysis. We did the content analysis for the interview, and we used descriptive, correlation, ANOVA, and hierarchical multiple regression analysis for the survey. So now we go through the findings. So we had about 1,000 survey responses back, 94% female, 83% white, and more than 50% of our participants were older than age 50. About 85% of our respondents worked in inpatient care facilities, and about 75% of them were a staff nurse or unit manager. So the average working hours per shift was 10 hours, and per week was 37. and about 63% of them work day shift, about 30% work night. And in terms of their break pattern and regulation, the average meal break duration was about 27%. The non-meal break duration was about 7 minutes. The non-meal, however, the average non-meal break duration was 7 minutes, but the frequency of taking those breaks we found was less than 1 per shift. So they hardly getting any non-meal break compared to the meal break.
That's pretty important.
And then we asked about their stress level in the work environment. The average perceived stress level was 7 out of 10, and the majority, about 70%, rated the stress level 7 or higher. So in terms of the design of the staff break areas, just a few general comments from our interview. One of the very interesting comments was from one of our nurses that we don't solve a lot of these problems that we have today unless we understand the importance of the built environment and how it really shapes our everyday experiences. And another nurses mentioned, we create usually those great, beautiful spaces for patient and family, but when it comes to nurses, we have those spaces in the middle of the building without any access to nature or outdoors. So the quality of spaces for patients and families are usually better than the staff. And go ahead, Naomi.
Sorry to interrupt. I was just wondering, when the nurses said that creating a good or a better space for patients and visitors was detrimental to staff, like what would be an example of that? Because we think, it's going to be great for everyone. So,
believe it or not, so when I visited the older facilities, they usually had better break areas because they usually transform a patient room to a break room, so they at least have a window. But when you go to the newer facility with racetrack design, they usually put the patient room outside of that perimeter, and they have the view and access to daylight, but they usually put all the staff areas, like even their nurses station or break room, in the core of the facility without any access to nature or outdoors or fresh air. That would be an example. And the last comment was, a lot of nurses mentioned they really don't have enough evidence or findings that they can protect these spaces when they design and they program for it. So the majority of when we ask about their staff satisfaction of their existing break areas, the majority of them, were either unsatisfied or neutral about both indoor and outdoor spaces. And now we are going through some of those, environmental features that can contribute to the design of a good quality staff break areas. So one of the most important one is the proximity. They really wanted to have, they mentioned over and over in comments that they wanted to have immediate access back to their patient. If there's a cafeteria in the first floor and they have to go there like from 8th or 9th floor, they usually don't do that, especially if their patients are sick. And then the delicate issue about proximity is that they really wanted to get away from that unit, from that environment mentally, but at the same time, physically, they wanted to feel that they are close to that unit, and they can have immediate access back to their patient in case of any emergencies.
And I've found that with my own research too, talking to staff, that they feel like if there's a garden, and the garden's usually off the cafeteria or somewhere else on the first floor, or maybe it's a rooftop, and they don't want to leave their unit. And so if the garden's more than 5 minutes away, then they're much less inclined to actually utilize it, even if they're allowed.
Yeah, that's true for both indoor and outdoor break areas as well. So the proximity, again, when we ask them, about their preferences for spaces that they go to take break. The most preferred, space was their break room in the unit as their first choice for both meal break and non-meal break. So they usually use that break room in the unit if they wanted to take either of these type of breaks. And again, proximity, when we ran the analysis, the hierarchical multiple regression analysis, we found that it was a great predictor of how much they took break. So if the break room was closer to their work area, they took more break more often and longer.
So for those of us, including myself, who are maybe less familiar with statistics, can you just explain very briefly what hierarchical multiple regression analysis is and what it does that something like descriptive statistics is not?
So regression analysis generally is a stronger version of analysis rather than just correlation. So correlation is just relationships, but in regression analysis we can actually see what variables is predicting our outcome. For example, in terms of independent variable, if the proximity is predicting more usage for that break area, more break for that stuff. And the hierarchical multiple regression analysis is a specific analysis that you usually put your variables in different increments, in different levels, in a hierarchical order. And usually in the first level, I put, for example, demographic information because I wanted to control for those and then go to the next level. And then in the next level, I put the facility information, I control for those. And then when I, felt comfortable about controlling all those confounding variables like demographic, facility information, now I can put the environmental factors and environmental features in the third level to see how now environmental features can affect our outcome.
Great.
Does that answer your question, Naomi?
Pretty nifty tool.
So in terms of the privacy and tranquility, they really need privacy in break areas because of two reasons. First of all, decompression. They wanted to distress during their break time. Second of all, sometimes they wanted to share the patient information with other staff, so it's a HIPAA privacy issue. And in terms of the tranquility, they really wanted to have quiet spaces. So we need to try to separate them from other activities like meeting activity or educational activity. They had comments about having it separate from lockers and restrooms. And if it's outdoors, they really wanted to have it segregated from families and patients so they can have their break time for themselves. So, and then when we asked the question about their existing outdoor break areas, it was about 87 of those break areas are open to public. So the green is what they have in their existing facility, and the blue is their preferences. But they preferred, hugely on the spaces that are private, either for all staff or nursing staff only.
That's a big difference.
Yeah. And in terms of the visual and physical access to outdoors, so they really wanted to view, outdoors and to get that daylight in terms of changing of the day, changing of season. They wanted to track that. And then at the same time, they had a lot of comments about accessing that fresh air, stepping away from that, indoor area, not just sitting there with four walls around, and they really saw the access to outdoor as a positive distraction. But when we asked about environmental amenity in their existing break areas, they, majority of them, about 60%, they didn't have any windows, and about 99% they didn't have any adjacent outdoor spaces.
That's pretty sad.
Mm-hmm. But when we did the analysis, the hierarchical multiple regression analysis, we found that, having windows and having access to outdoors are significant predictor of how much they are satisfied with their indoor break areas. And access to nature and daylight is one of those very vital principles that we looked at for this study. So a lot of comments about having nature, plants, trees, bushes, flowers, just listening to the nature sound like running water or birds, and at the same time, having that fresh air, access to that fresh air and daylight. However, when we ask them about environmental amenities, we can see that only 40% of them had views, had windows. About 10%, only 10% had artworks, and 4% had plants and flowers. And when we ask about the views, so what they can see in their existing views, outdoor views, we can see that, so the green is the existing, again, blue is the preferred view. So in their existing, they mostly see building and signages, sky, car and traffic, but in preferred view, they really wanted to see tree, flowers, park-like areas, nature elements. And based on that analysis, having that artwork, having that windows, that access to outdoors, and views to trees and sky was significantly, associated with their satisfaction with the indoor break areas. And as you see that the car and traffic, the views to car and traffic is negatively, associated with their satisfaction. And now we go back again to that visual assessment set. So we had two sets, and this is the question that we asked. On a scale of 0 to 10, evaluate each room in terms of how effectively it helps relieve your stress and now makes you feel more refreshed. So this is one set, and then this is another. We select two sets, so if we can see one result from one of them to see if the other one confirms or contradicts. And this is the result. The result is, first of all, the restorative qualities for the room without any, added environmental feature was rated as the lowest, and the room with balcony was rated as the highest in terms of restorative qualities. And this was true for both sets. Set 1 is green, set 2 is blue, and as you look at the graph, it's very systematically the restorative quality, the ratings goes up from a simple room to a room with plant, to a room with painting, to a room with window and balcony. And then we ran more rigorous analysis rather than just descriptive, like ANOVA and THST test, to see if they are significantly different. And each of these two photos in both sets, the difference is significant, is statistically significant.
So that's interesting, because basically a lot of people ask that about, isn't just a view okay, or, can't we just put some nature art up or stick a plant in the room? But what you've found is statistically significant is that people really preferred a window, or the highest preference was for real physical access to nature. So
exactly. Yeah, so that the thing that I need to mention it here, that visual versus physical access to outdoor. So I'm just having that balcony that can open up to outside, just stepping away from that indoor room to an outdoor area was evaluated significantly higher in terms of the restorative qualities. And then we looked at the additional amenities. We asked them, what additional amenity do you want to have in indoor break areas and outdoor break areas? So this is just a word cloud of the frequency of those words that was repeated. Like for indoor break area, repeatedly they said window, comfortable chair, recliners, music. And for outdoor, we saw shade, we saw fountain, benches, water. So it was interesting in terms of just additional amenities what they wanted to have.
And I guess a question for you would be, of those findings, what was the most surprising to you? Something that you really hadn't expected?
I think the most surprising data maybe from this study for me was how much policy and programs is play an important role in supporting staff taking refreshing breaks. So it's not all about design of beautiful spaces. So one of the things that surprised me, because we all, as a designer and architect, we wanted to create, beautiful spaces, practical spaces, but here the taking the time off during the day is really ties to this, facility and to the facility policy and regulation. So based on my literature review, in United States, we don't have any federal regulation to mandate or compensate. And it really goes to each state, and then after that, it really goes to the facility level to push and support this idea. So, so the study leads to, first and foremost is the policy implication. So in that, the absence of that federal regulation, it's really important that facility manager implement better break policies and programs. So without policy and program, if we create the best environment to take breaks, if they don't have that program policy, they are not really going to use it. So they are programs that have been developed and have been implemented, like the Transforming Care at the Bedside initiative at Massachusetts General Hospital, the model of collective booster break, and recently the Veterans Health Administration, they are implementing a strategic napping program in their facilities.
That'll be interesting to see those results. And, for us as designers, it's frustrating because we want to think that we can just solve all the world's problems with design. But very important that you found that, no, we can't. We actually have to look at the policy as well, that it's not just about the physical design of the environment. Exactly. Especially for this topic, policy plays a very important role in supporting the staff to take breaks. And in terms of the design recommendations, so we are going to just summarize what we have talked about in the results section. So proximity is very important. Just decentralizing that staff break areas throughout the healthcare facility. If we are going to provide an outdoor break area, so we should do that by including small balconies, private patios, and garden that are directly adjacent to those staff break areas. That would be the ideal situation. So in terms of the privacy and tranquility, really segregating it from the spaces that patient and families are using them. If it's possible, incorporating those one-person respite rooms along those more traditional groups. And then even when we design the layout for that break room, we need to include that nooks and corners with those comfortable and movable furniture so they can adjust it based on their need at their, at their certain time. Sometimes they want it to be private, to have privacy. Sometimes they want it to
talk in a group and socialize. So, and then separating them from other support areas like toilets, locker rooms, meeting spaces, any type of spaces that create noise. And in terms of the visual and physical access to outdoors, just incorporating the physical access to outdoor, as much as possible. It can be a window that can be opened. It can be a small, private balcony or porch, and more luxurious feature, we can have a small private garden or rooftop terrace. And in terms of access to nature and daylight, we can, we can all take those possible cost-effective steps, in order to incorporate that natural element. So the best one is just direct access to nature and daylight. But if it's not there, if that possibility is not there, just the presence of that window can help a lot. And even our study showed if those are not possible, having indoor plant or nature artworks, those are, were evaluated with higher restorative qualities than just a room without any environmental, without any natural element.
I would assume that part of that fresh air, then that an operable window would be preferable so that at least people could open the window and hear the sound of birds and smell like after rain and that sort of thing.
Yeah, and we all know that's a great issue, especially in hospitals in the United States. And then, as an additional amenity, I had a lot of comments from staff on their need to put their feet up. They walk a lot. They're tired. During the break time, they really need to, put their tired feet up to get some, relaxation. So in terms of indoor break area, comfortable furniture, movable furniture that can be rearranged for individual and group activities. Even they had a lot of comments about amenities like refrigerator or computers with internet access. And in regard to outdoor break areas, comfortable seating, covered patios, and a rich natural environment. Those are very, those are most frequent comments that they had.
I have a question that might be good for here. This was written in by one of the participants. Whether you had any conversations regarding the condition that the break areas are left in by their coworkers. This person has seen a lot of examples of break rooms where there's just, a terrible mess left. And so she said, did you survey the respondents regarding the detail of their current environments or just the general level of satisfaction?
So the level of, detail that I asked for their existing, I asked both satisfaction, general satisfaction, and both detailed question about their environment, about their existing environment, but the level of details that I went through, it was mainly focused on the environmental features that was part of, focus of this study. Like I mainly focused on environmental features that nature has something to do with it, like windows, artworks, music, and plant. And then additional amenities, I asked to see if what amenities they have, what amenities they wanted to add, and I asked also detail what they view from that window or balcony that they have. So these are the level of details that I asked about their existing, and also I asked question about their future and future break areas if someone is going to design and build for them. Hopefully this answers her question.
Yeah, I hope so too. I think so. And then a question for you from me. I'm sure that a lot of our participants are excited about your research and findings. And so if they want to go back to their facility as the designer or the provider or the facility manager and implement something tomorrow, what would you advise them? You have some pretty concrete evidence, and some of it is relatively low cost, and some of it is a little more expensive or might have to be done with a renovation. So what would you recommend as far as what could be done tomorrow, and then how could something be phased in over time?
I think what they can do tomorrow, based on this study, first of all, it's a very policy-related comment that separate that, break room from any other type of activities. Like if it's meeting are scheduled in that room, if you guys have educational activities in that room, just remove, if you have the spaces, move those activities to the other areas and have that break room just for breaks. So even separated from lockers and, the restrooms, so they can, all the activities that are noisy. So we wanted to have a private and quiet environment for staff when they're taking breaks. I think that, second thing that they can easily do is just adding those indoor plants, adding those nature artwork. Those are not that expensive, and it doesn't require a renovation or anything like that. Or adding, those comfortable and movable furniture that can be rearranged for their purposes. I know that some of the break room, they're going to add some recliners or massage chairs for staff, for the, that they can use during their break time. And believe it or not, I visited a lot of facilities, even though that they have windows, the blinds were closed, and that room was dark. So if you have any windows, just open that blind, clean that window, open that window, and if the view is not gorgeous, at least let some daylight come in. As we know, daylight is, one of those environmental features that is affecting our health directly. Like it controls our hormonal systems and makes us happy and more, energized. So I think these are some of the comments that they can do like right tomorrow. But in terms of if they don't have any windows or balconies, that requires their attention during the renovation if there is a possibility, or during their new design. I hope this answers your question, Naomi.
I think so. Yeah. So we should get to the questions, but did you want to?
So we have the research limitation in this, presentation, and then the future research. If you guys wanted to go through it, we have it in the paper. And then I also, published the result of this study in 3 other papers. These are different types of findings from the same studies. So if you guys are interested, you can, access those papers and let me know if you need the PDF of it. I can send it to you individually. I cannot share it publicly. And then now we can open to question and answer. Yeah, sure.
Yeah, and just to let people know, this talk will also be available. I believe it's being recorded, but I think a PDF of the presentation will also be available. So let's see, we've gotten some good questions. And so remember, as a reminder, you want to chat your questions into the little chat window. And the first one, were there responses that shed light on the fact that physicians do not want to share break areas with nurses and others? I wonder specifically for non-meal break areas. So did that come up in your conversations or in the survey with nurses about that separation of space with doctors, physicians?
Mm-hmm. So that wasn't the focus of this study. I didn't have any question in the survey about that. I wish I could add it later. But it came up in my interviews that a lot of physicians don't want to share their break areas with the staff. They usually have the nicer, luxurious, better, break areas compared to a staff. I think maybe it's a two-way relation. It's not just physician don't want it to share it with the staff. Maybe a staff doesn't want it to share it with physician as well. But I didn't have a question for that specifically in my survey. But it came up in the comment that a lot of physician staff break area are more nicer, cleaner, and luxurious compared to staff.
Let's see. How about this one? Did you study private restorative spaces? So I think this is asking whether, in addition to the three methods that you used, that you actually went to break rooms in facilities and studied those break rooms.
So a study started with informal visits of staff break areas within a lot of facilities. I toured a lot of facilities. I saw, one, private break rooms versus group break rooms. I saw a lot of, facilities with where they didn't have any staff break areas in the program, but they added, after the fact by renovating and, for example, having a patient room, as their break rooms. So the study didn't have the, the methodology to go and systematically observe and collect data, but as part of, just getting familiarized with the environment, I toured a lot of facilities in U.S.
And we're getting a couple questions about stress levels, and one is, do you have any measures of stress levels in addition to surveys?
To that specific question. So since the survey was long enough, and since the staff are, when I received 1,000 completed survey, I was so amazed because these are people who are busy and they don't have a lot of time. So since the survey was long enough, and I really wanted to focus on the environmental feature for staff break areas, I didn't include any, those validated instruments for, evaluating and measuring staff stress. And I just had, a few questions to evaluate their stress level in the work environment from, level 0 to 10.
And that was where you found that they reported their stress level as being around a little higher than 7, right? From 1
exactly.
to
The average was 7, and about 70% rated, 7 or higher out of 10. So I just wanted to confirm that, the literature that I was reading, that the hospital, workplace is one of those stressful work environment, and I really wanted to see if that's true for my audience. If they are perceiving the same things, it somehow confirmed that literature that has existed.
We're getting a couple questions about the photo surveys. So I'll one is about whether you had did you have 2 sets of photos?
Exactly. I had 2 sets of photos.
Right. So someone was asking whether you had another set that had different tables or chairs, or perhaps something more comfortable. As I understand it, when people were asking for something more comfortable, that wasn't because they saw the picture. That was something that they just wanted. Right.
So the question about the additional amenities, the comfortable furniture that came mostly in the additional amenities, was before when we showed them the visual assessment. And then the main focus for the visual assessment really was to evaluate the restorative qualities of higher access to nature and daylight. So we didn't focus on changing, furniture and, replacing it with comfortable or movable furniture in photos and ask them. It really focused on how people are evaluating spaces or rooms that have higher access to nature and outdoor and daylight. So that was the main focus of the visual assessment set.
And did you get any, where did it go? More questions are coming in, so my window just changed. Did you get any insight into the performance of staff who are more satisfied with their break rooms? Does it lead to any improvement in care or patient satisfaction? I think you mentioned some of that in your literature review that you had found that.
Yeah.
And
so that's,
how does that correlate with what you found?
So this study really didn't focus on how their, staff satisfaction ties in to the patient care, the quality of patient care, and the quality of care that they're delivering. That would be another great, follow-up study, I can say, because I couldn't find any in-depth, comprehensive, study in break areas, staff break area, at least in my literature search. I thought that I need to do one more general study in this topic to see how existing break areas are looking like nowadays, what they prefer. I think that study, which would be a very interesting study, it sounds like a great future study to see how staff satisfaction with their break area, to see how much, the break that they take helps them, their break patterns helps them to deliver a higher quality of patient care. And for this study, unfortunately, we didn't have time, and it wasn't the focus of this study. I only had 3 or 4 years of doctoral dissertation, and I wanted to graduate.
Hopefully, there's a master's or PhD students or postdocs or people in a design firm that has a research component. They will take your challenge and take it to the next level.
Mm-hmm.
Let's see. I think we have time for one more question. Did you study both critical care and medical surgical nurses?
Just medical surgical nurses. So the study really focused on medical surgical nurses, and all the members of Academy of Medical Surgical Nurses work mainly in inpatient med-surg units. So the focus of the study was med-surg. I know this topic is more critical for nurses who are working in ICUs, and also another aspect of it is for nurses who are working in spaces that even their work areas doesn't have any access to outdoor. So, for example, for med-surg nurses, they at least go and see outdoors from a patient window. That at least their work areas, which is patient room, it has window. They can see outdoors, even though that they're focused on patient. But in some areas like radiology, like surgery areas, or pathology, the nurses doesn't have any access to outdoor, even in their work environment. So the significance of having that break areas that can, give them access to outdoors, give them access to nature is more vital, and would be great further studies as well.
Absolutely.
Focusing on staff who are working in other settings.
Yeah. Well, I think that's all the time we have today for questions. I'm sorry, there were one or two that I wasn't able to get to, but we're almost out of time.
If they can send me the question, I can answer it directly.
Okay, that's wonderful. Thank you. And the paper is available. Hopefully people have already read it, but it's still available. And then we have the references also to the other papers that you've written. So before we wrap up, thank you so much, Adela, for your time and for this really...
Thank you so much, Naomi, for hosting.
My pleasure.
I really appreciate that.
So as a final reminder to people about CEUs, if you'd like to earn continuing education credits for this session, download the form found in the Media Library. For your credit from AIA, you need to purchase a CEU management fee, complete the CEU verification form and quiz, and email it to Shannon Reckline. And please save the date for the next EBD Journal Club. It's going to be on June 1st at 1 o'clock p.m. Eastern Time. We're going to have a discussion with Rose Gunn and Dr. Chandra Brown-Levy on how design can impact the integration of behavioral health and primary care. So that should be really great. And also, important, quick announcement that the Center for Health Design will soon be announcing their request for proposals for the 2016 New Investigator Award. This is an amazing opportunity, so try to spread the word. Proposals will be due in September. If you know anyone who may be interested in applying for the award, please let them know to check the Center's website for more details. And finally, this event has been brought to you by the Center for Health Design. Thanks also to Herd Journal and Sage Publications for providing free access to the articles we typically review. If you have not already done so, we recommend subscribing to Herd. It's a great journal. And special thanks today to our thought leadership partners, Steelcase Health and Gaping Void. So this concludes our event. Thanks, everyone, for joining, and thank you again, Adela, and have a great day.
Thank you so much, all, for joining us. Thank you, Naomi, and thank you, Center for Health Design.